We've got now on our agenda a presentation from Kingston Hospital, and delighted to have colleagues Sally Brittain and Sarah Shade join us today. They're going to perhaps introduce themselves when you actually sort of do your presentation, and we're going to hear how Kingston Hospital has been managing during COVID and what plans are in place to support patient care moving forwards. All right. I don't know which one of you is going first. Is it Sally?
Thank you. I'll just say a few words to start with. Yeah, thank you. Thanks very much for inviting us. Yeah. Thank you.
Would you like me to share the slides now?
Yes, please.
Thanks, Jamie. Thanks, Sally.
So Sarah, as she's introduced herself, she'll introduce herself in a minute. I'm Sally Brittain. I'm the Director of Nursing and the Director of Infection Prevention and Control, and I've been at the hospital about just over 3 years now. We've just done some very generic slides, and please feel free to ask us questions, obviously. The reason we did them generically is because, as with everything, the pandemic changes on a daily basis, and we have to review and revise what we're doing. So we'll just give you an overview. If we can't answer all your questions today, obviously we'll come back to you. But the first, I think that's the last slide actually, rather than the first one.
Sorry.
Yeah, that's all right. Don't worry, it's fine.
So
Sarah's going to take you through the first one.
Yeah, so I'm going to start off and just sort of talk to you, cover the current position operationally and the changes we've put in place for our services at the hospital. So firstly, I really just want to remind everybody that, of course, we have to be mindful of COVID and follow the guidelines in place. That the NHS does have capacity and it is open for business. So we do urge everybody, when they're feeling unwell, to seek that medical attention. So whether that's via your GP, 111, urgent treatment centres, or the emergency department. So within the trust, from an operational and clinical aspect, we are running our what we call silver and gold command 7 days a week, and we produce an internal daily COVID situation report. In fact, that's twice a day, and that is circulated to the executive team and the senior operational and clinical leaders and managers. So they're fully cited on, the number of positive patients, COVID positive patients we have in the trust, looking at our ED performance, our patient flow, bed availability within the trust, as well as the community beds available, our PPE stock, looking at our workforce sickness, staff that may be isolating. So we have that good overview operationally, what is happening, and obviously address challenges as they arise. So Jamie, I don't know if you want to go on to the next slide. So firstly looking at our emergency department. So patients are triaged at the front door by a nurse, and depending on their presenting clinical symptoms, then we will allocate or direct them to the relevant location within the emergency department. So we have sort of zoned the emergency department. So we've divided all areas. So like resus has 2 areas, what we class as red and green, the same for majors, the same for minors, and also pediatrics. So obviously from an infection control aspect, we're very mindful of COVID and covering that aspect as soon as you come into the emergency department. So on the decision to admit, then all patients will have a COVID swab and then therefore admitted to the relevant ward area location depending on their clinical presentation. So whether that's the surgical ward or our acute assessment unit or the paediatric unit. And then from there, once we get the swab result, then we move them on to the relevant inpatient ward. So going on to our inpatients, so again, we have looked at all the ward areas and we have sort of zone them and allocated code colour to ensure that we've got that correct patient flow from the ED department and that acute assessment unit, depending on their swab results. We also have a protective pathway for our super green elective patients. So we've got an allocated surgical ward that is classed as green elective, and we are using day surgery as well for all our green elective patients. And we've now implemented that we can accommodate patients if they need to stay overnight within the day surgery unit. So we've expanded that service and we're able to cover that 7 days a week. For the elective patients, we are also using the new Victoria Hospital. So some patients will have their elective surgery at the new Victoria. Any patient that has got planned surgery or procedure, then they will have a COVID swab 72 hours prior to that surgery and procedure. And then from that point, we ask them to self-isolate prior to coming in. So currently we are at 85% business as usual with our elective surgery, and in some specialities like pain and ophthalmology, we're much higher than that, like at about 121%. So the team have really worked really hard in making sure that we're back up with our elective program. Looking at outpatients, so again, currently we're at 100% business as usual within outpatient service, and that's a combination of virtual and face-to-face appointments. So wherever possible, we will do virtual appointments, and that's really to reduce the risk for patients and staff, bringing people unnecessarily into the hospital and just reduce that footfall. We have gatekeepers, so again, that is the case for the elective patients and anybody coming in for their outpatient appointment. So on entry to the hospital, we have gatekeepers. They will check the patient's temperature, provide hand sanitizer and a face mask as well. And within pediatrics, we have what is called, we just set up, and it happened this month, the first one, our pediatric hubs. So paediatric consultants have been working with GPs, and they're now running joint clinics based in the community, so based at the GP practice. So again, this is really positive, much better for the children and young people, because we're not bringing them into the acute hospital unnecessarily, but they have access to a paediatric consultant. So that was our first one this month, which has been really positive. Then going on to maternity services, throughout the pandemic, we have been business as usual, and we've continued to allow a birthing partner to be present for the birth of their child. And again, we have the gatekeeping process. And again, the maternity unit covers all aspects of infection control, which Sally will cover a bit more later. Then finally, cancer services. Again, throughout the pandemic, it has been business as usual, ensuring that patients are getting screened, getting the diagnosis, and therefore getting the relevant treatment. So we have been very proud of our performance in relation to cancer services. I'll hand over to Sally now to cover the other aspects.
Thank you. Can I have the next slide? Thank you very much. Thanks, Sarah. I think that...
Sally, sorry, before you start, because it's a question pertinent to what Sarah's just presented.
Oh, okay.
There was one question from Tony in the chat asking...
Oh, I can't. You're on silent, I can't.
I thought I'd unmuted myself, I apologise. Tony asked a question in the chat. He was asking, what is a super green elective patient? Yes.
I know. We did initially call them green patients, but I suppose it's, and then South West London, we the term was given soup and green. It just means that they have had a COVID swab, that COVID swab is negative, and they have been isolating for a period of time. So it's just really that extra precaution to reduce the risk. Yeah.
Excellent. And can I ask a follow-up question from me? Do they then get a T-shirt or a badge?
They don't, but I think we maybe do need to look at stickers, don't we?
I think that would be fun. Absolutely.
Yeah.
Right.
Yeah.
Over to Sally and more serious things. Right. Thanks.
Thank you. Thank you very much. Thank you. I think the first thing to say about infection prevention and control is that it's changed so much during the whole of the pandemic. And the first thing I suppose to say to you is thank you. Thank you for supporting us. It has been really difficult, and I'm in no doubt that you've had the same sort of concerns raised to you as we have about how we keep patients safe and how we keep them coming in. It is really important, if I could impress nothing else, that we ask our patients to keep coming. I think the front door, we need to make sure people are going in the right direction and not just coming straight to ED, because obviously overcrowding is the last thing we want. But for all other aspects, we want our patients to come to the hospital. We are, as Sarah said again, we're working over 100% of our capacity in some areas to ensure that we can get through the backlog. So that's really good. In terms of what we're asking patients to do now, they're basic things really. Although it's really tricky, we would always ask that if you don't have a carer or have a specific need, you come to the hospital on your own for your appointment. And what we have been doing for some of those appointments, and indeed on the ward, is putting the doctor on speakerphone when they're talking, so that your loved one can hear what's being said, but actually you're not in the room. And that really is about infection prevention and control. We all know that the rate of infection in the community in Richmond is high, very high, one of the highest in London. And we really therefore have to assume that most patients are positive rather than assuming they're negative. And so it's really important that you come on your own. In terms of the other aspect, has been visiting. That has been really tricky. We found it personally at Kingston very difficult when we had to stop visiting. It just isn't something we do at Kingston. We've never done it, and we really like to involve our relatives and loved ones. They help us with communicating with our patients. They help us to ensure nice meal times, you know, to get patients well and up, and they help us to plan discharges. So when we had to stop visiting, it was really difficult. We never stopped maternity visiting, as Sarah said. We didn't stop paediatric visiting, and we didn't ever stop visiting at the end of life. And because Silver Command was running 7 days a week from 8 till 8, certainly there were a couple of weekends when people came up and I was in there, and we were able to discuss how we could support more than one visitor coming in at the end of someone's life. And I think a lot of that was talking about the risk to the relative, because sometimes when you're at the end of your life, your relative is very vulnerable based purely on age. And so it's important that people understand that and take the risk that's okay to them. Visiting wise, we set up virtual visiting, which was a great success. That's been really brilliant, actually. We've got some iPads, we've done some training, we've got IG signed off, we've got buy-in from staff, and we have lots of virtual visiting. We also have message to a loved one. So you can bring a message in and we will take it to your loved one. You can email in and we'll take it to your loved one. And then also obviously we didn't really have any complaints or PALS concerns during the COVID. People were very generous in leaving that aside for us to get on with our work. So that meant that the PALS and bereavement team set a service up where you could come to the front entrance and drop off clothes or food or anything for your loved one, and they would run it up and down to the ward. Some people had all their food delivered that way, and what the patient said was that actually eating a sandwich that your loved one has made for you, it was just that little bit of connection. And I think we can probably all think about that, you know, when you open your packed lunch, if your partner's stuck an apple or a note in there or something, you know, those things are really important to Kingston and to the patient. So that was really good. At the moment, we're following the guidance on visiting. So we set up visiting only on the medical wards, and you'll understand we don't want visitors to surgery because we need to keep those patients and the staff who work there absolutely as low risk as possible. But on the medical wards, you can ring up and you can book an appointment for visiting. You come in at the front door, and in fact you have a sticker, which is great, and you get your temperature checked, and you get a face mask, and you ensure that you know where you're going and how long that you can be there. That has worked really well. We've had, touch wood, no complaints about that at all. So that has been really good. We will keep an eye on the guidance. Certainly yesterday I was talking to the chief nurse at Croydon, and we agreed that we are both absolutely in alignment in terms of the fact that we don't want to just rely on the rates of infection in the community to make a decision about visiting. And we've decided to stay as we are at the moment because we think that we can police it. So that's really good. When you come to the hospital, you need to wear a face covering. Obviously, we will ask you to change that, as you can see in the picture here. So this is at the front of our outpatients. So the staff who are there, they'll take your temperature with the gun-like thing. They'll ask you to put one of our masks on and leave your face covering, and that purely is just for our own assurance as much as anything else. They'll ask you to gel your hands, and then they'll ask you to use the one-way system and only sit on the seats that are designated. And we tend to be calling people through really quickly. That's been really good. Our staff.
Sally, we lost your sound momentarily. Could you go back a sentence? Is that possible?
Yes, what was I saying?
You were actually just talking about basically sort of asking people to sit in designated seats.
And then following the one-way system. Yeah, so that we're moving people through the hospital quickly. And that's been helpful because we haven't got as many people coming to the hospital. So that's been helpful. I've put what we ask our staff, but I know if they were here, our staff would want to say thank you to you because we would never have got through what we've been through and perhaps what's coming again without knowing how much everyone cares about us. I don't know if anyone follows me on Twitter, but the day right at the start when I came out of my office and saw someone had put a poster up, in fact, it's making me feel quite tearful now, just saying, keep going, you know, we love you, thank you very much. People really, I'd love them to know how very much that meant, you know, to us. The food, we couldn't, I mean, there were no breaks. You can't get out of all that kit and get back in. The food that was delivered was absolutely brilliant. It meant that those 12-hour shifts we all did, you had some lunch and you had a hot meal. So when you got home, you could just have a drink and go to bed to get up and do it all the next day. We had loads of Lipsol. That was brilliant because the masks make your face so dry. We had hand cream from the hand washing. We really, really appreciated it. It made all the difference, and the lovely messages, so thank you. What we're asking our staff to do now is try and take some breaks because obviously no one wanted to take a holiday because everyone wants to help each other out, but we've sort of insisted now. Sarah and I have had a little break, which has been really important just to recharge batteries. And we've asked a lot of them to just make sure that when they go home, they remember that they're members of the community. So it's really important for them to make sure they're following the really strict IPC guidelines, infection control, so they're not taking infection out into the community. And then how we're working across South West London. So there has never been such an opportunity at scale and pace to sort of work in an IT way like we are now across the whole of South West London. So that's been brilliant. We have got a South West London Infection Prevention and Control Group, which I sit on, and we meet every Wednesday. Last week we met for 4 hours because there was so much to do. But it means that as we move forward, all of the hospitals in South West London have the same policies, the same procedures, the same isolation. That's been invaluable. It's been really supportive for us in terms of, I suppose we've had to make a lot of decisions. And I think, you know, as the Director of Nursing as well, I've had to make a lot of decisions quite quickly, and it's been quite nice to have my colleagues to share that with. We've also got a South West London Chief Nurse group, which I chair, and we meet every month, but actually we've been in contact most days. Obviously, we've also got now a joint recruitment hub across South West London and a joint bank, and that means that outside of the hospital, lots of recruitment is ongoing, which is really important. In terms of some assurance for you, the Department of Health issued us with a Infection Prevention and Control Board Assurance Framework about 2 or 3 months back now, which we completed. That went to our board and then was revised and went to our board, and it's on a 3rd revision now because we've had some updated guidance. We've had an assessment from the CQC based on our board assurance framework and evidence that we have provided to them, and we did very well on that. We didn't have any recommendations at all, no must do, no should do's. And then we've just had a South West London Infection Prevention and Control assessment, which was part of a peer review led by South West London ICS. And those results are going to our CEOs on Thursday. But we haven't had any indication that we've got any actions as a result of that. So there has been a lot of overview, which is also supportive. Do you want me to do some questions before I move on?
Oh, I was trying to unmute myself. I'll ask you quicker than that. Sorry. Yes, if I could, if it's a good time for you, because there are a few in the box.
Yeah.
I'll take them in order that they arrived. One from Liz asking, she may have missed this, but where are the paediatric hubs? I was under the impression that they were at GP surgeries, but which ones, I guess?
They are GP practices. I must admit, I haven't got the details of which specific GP practices.
Okay.
Yeah.
I mean,
apologies.
maybe you could share that with us afterwards, if that's possible.
Yes.
Jamie and I will pick it up. Thanks. Next one from Councillor Shapper. Sorry, reading it. What has it been like dealing with the backlog in surgeries, outpatients, and how long has it taken to get back to pre-COVID levels?
It's been really tricky because initially we were trying to step down some of the COVID, step up the elective pathway in the outpatients, and now winter has started. So it has been very complex. And I think we've had to divide our time and make sure that we're only focusing on one thing per person, because you could get you can drown in it all. I've got a fantastic team, or we've got a fantastic team here. But as I said, for some specialities we are almost back to where we were. Other specialities are going to take some time. In terms of, I mean, the cancer, we are absolutely, there's no wait on the cancer at all. But some of the other work will take a little while to get back. I shouldn't think it will take too long. I mean, again, if Tracy were here, she'd be able to answer it definitively. But the other thing is, we have obviously got a South West London patient tracking list now, which we've been working on. So if other waiting lists are much longer than ours, we've been continuing with our backlog, but we have also been supporting other trusts, because it would not be right for us to be doing something that really wasn't elective. Really wasn't life-threatening when we had people with life-threatening or life-limiting care that hadn't been done. And the other thing we've done is we've gone for so at the New Victoria Hospital, we've been doing high volume, low impact things. So those simple things they feel very simple to us. They're not very simple to the people that are having them, but the things that we can get through quite quickly. So that's been really helpful. I hope that helps.
Thanks, Sally. There's an observation here, and a frustration really. One from Andrew saying he's been struggling to get a blood test as the 2 numbers provided never seem to get answered. Then it goes to voicemail, and then it asks for a voicemail not to be left. He said it's rather frustrating. So perhaps a glitch in the operational system there, which maybe you could look at if that's possible.
We are setting up a new service. I mean, blood tests is really tricky because we shouldn't be asking you to come to an acute hospital for blood tests. And I think that's some of the bigger piece of work that Tracy is doing now.
Excellent, thanks, Sally. And a question from Gillian. What is the current situation at Kingston Hospital, as in use of ICU beds, for example?
We have got availability for up to 15 ITU beds. At the moment, we are not inundated with COVID patients. In total, we have 8, I think, today. And one of those is in our intensive care unit. and that patient has been there for some time, actually.
Okay, thanks. Here's a message of support from Rona. She says, "We love you, NHS!" Exclamation mark. And you all deserve a pay rise. I'm sure that's music for your ears.
Thank you very much. Thank you very much.
Justin sent his apologies. He had to leave to go to another meeting. And I believe there's one from Charlotte. How are sight-impaired people going to see the one-way system?
It is very tricky, but mostly, obviously, patients come into the REU where they are very used to moving around. There is a volunteer at the front door, is the answer. I saw them in action this morning. What we've done is we've had to move to virtual volunteering, which has been quite incredible, and we've revised our strategy as a result of that. That might be another conversation we can have with you at a later date, the volunteering. But our younger members of the volunteering service who feel able to help and don't feel too at risk are helping us move patients around the organisation. So just this morning I went down there and there was someone helping people around.
Excellent, thanks for that. I'm combining two questions here, both on discharge.
Okay.
Well, so we're going to cover some ground from yesterday properly, Sally. So what's changed on discharge from hospital, and any regarding reablement and home care? That was from Candy, I believe. And then there's another one here. What is protocol for discharge of elderly patients from care homes whilst test results may be pending? Is Teddington still being used as a buffer? So that from Alan Moss. A couple of questions in there as well. All stuff we touched on yesterday.
Yeah. So in terms of discharge, all of our patients going to care homes have 2 negative swabs within 72 hours of their discharge. And in fact, we met with all the care homes yesterday, and so that was really good, just to try and do a bit of myth busting and see how we could help and see how we could work together. So we did not discharge one single positive patient to a care home intentionally. So, I mean, people have obviously incubate the virus, and we don't know unintentionally whether we did it, but everyone has had, since the 29th of March when new guidance came out, everyone's had 2 negative swabs. Those patients who remained positive, even though they were fit and well, and I think we had a gentleman who was positive for 6 weeks, completely well, they can go to Teddington Memorial. So again, I spoke to Sarah, the chief nurse who covers Teddington yesterday, and they are still ready and able to take patients from us if we need to. They have side rooms cleared and ready to support patients before they can go back to their care home. At the moment, we don't need to because we've got so few patients in the hospital. So it's not been a problem. And obviously, there are still many, many patients who come in with COVID who go home, which is fine. So it's not as relevant for those. And the turnaround, I mean, I am not aware of any concerns around reablement and support and care at home. I don't think that we had anyone in the hospital who couldn't go home because of that. Every Friday, we have a meeting with execs and very senior leaders from the community, and we go through all of our patients who have been here a long time and think about what requirements they might have and try and work through things together. So for instance, an example, we had a patient who needed to go home, but we couldn't organise the IV antibiotics. The CCG then subsequently paid for an agency nurse to go in regularly and give those IV antibiotics. So I think working together has been one of the absolute best things that's come out of this. So yeah, it's been amazing.
There seemed to be good collegiate sort of working going on yesterday in the discussions within the provider forum meeting I attended. At yesterday's meeting, you mentioned obviously the excellent work that PALS, and we've heard again today that PALS have been doing to support patients in wards, and that personal touch I'm sure was very welcome. In regards to the discussions that were raised yesterday about reintroducing or reinvigorating, I think the term that was used, reinvigorating the red bag scheme for those coming from nursing homes and other care homes. Could you share your views on that and why that's likely to come into play now?
Yeah, so that was sort of in full flow before COVID. So the red bag is where patients are coming in from nursing homes and going home again from us. And the red bag is really useful because not only does it highlight to us immediately that someone's from a care home, but it allows all of their information and any really special bag that we are. And that has been really important. We need to get that up and running again. It means that patients come in with all the right equipment and the information that we need, and then we send them home with the same equipment, because often patients from care homes don't come in with anyone, and actually even if you're in your own home, even if you come in alone, which we do with everybody now, someone probably has packed your bag for you and got everything together, and you're more likely to be able to tell us where your things are or tell us about yourself. And what has really helped that actually is the connecting my care. So now I can log on to my computer here and I can look at your GP records. I can look at any other records you might have on the system, and that's been invaluable. But if you've got the red bag, it's that first real clear trigger that you've come from a nursing home and that you're going to need us to have a good conversation.
That's helpful. Thank you, Sally. My apologies, Paula, and thank you for nudging me, Candy. I overlooked a question from Paula, who's asking how are things on the dementia wards? Are any visitors allowed or activities taking place? So thanks, Paula.
Yes, well, we do allow visitors. Again, it's through the booking system, although some people do come every day, and that's an absolute very real need for that one particular patient. Obviously, the activity room is tricky because we've got to do social distancing, and what we don't want to do is restrain people from wandering and from moving around and for interacting, which is really difficult. So we have limited the amount of people that go into the activities room, but we've enhanced the dementia care team. So we now have an additional dementia and delirium nurse, and we have additional healthcare support workers who, and in fact, we have the most fabulous addition to the team, who's an actor. So has just been incredible. And now we take the activities to the patients rather than expecting them all to come to the wards. And we've now got the team to enable that to happen. So that's been really good.
Excellent. Thank you very much. I will ask you to keep going at the end of this session as a way of thanks to everything you're sharing with us today, and obviously the work you're doing in the community. I think back to your presentation, if I might. I'm mindful of time.
Yes, thanks. Last slide. Thank you. Thank you. So obviously I said before our staff have been amazing, and taking care of them is really important now, because if we take care of them well, then they'll be able to take care of our patients well. Just some assurance around safe staffing. So as Sarah said, we know exactly who is off from exactly which areas every day, which helps us look at the bigger picture. But the bed meetings and the staffing meetings we always have continue, and our staffing policies are unchanged in most areas. So we have a view of staffing every day. Sarah's in Silver today with me. Sarah will know exactly who is on duty in which area and move people around in order to make sure that the staffing is safe and we have enough staff. ITU was the one area where staffing changed during COVID. Obviously, we had at one point 25 plus patients who needed enhanced care in 3 areas. So on our ITU, on our second ITU, which was Alex, and on Hamble Ward, where our patients who needed respiratory support. You'll have seen the hoods actually on the TV. That's where those patients were. That meant that we needed to dilute the ITU staffing. And that was done using the guidance that was issued to us. So there was a ratio of, I don't want to say diluting the workforce because that isn't what I mean, but there was a regime to follow. So there was always a governance framework around it. And so into our ITU went our theatre staff, our recovery staff, who are obviously used to looking after patients who are not awake and being ventilated, and then our physios who joined our proning teams. You'll also have heard people were turned onto their tummies to help them breathe more easily. And that was incredible. Subsequently, obviously, lots of training was done. Subsequently, additional free training has now been issued to us. So there's a one-day course, which is then followed up just to keep those skills up for the second wave, should it come. And if you want to hear about our staffing, on our trust board, if you go onto our website, I think it was the first meeting we had virtually, there's a fantastic video that you can watch where our staff are telling you what it was like on ITU. It's very moving. But our staffing is safe, so that's what I'd like you to go back and assure your people. Our staff have needed a lot of emotional support. If you think about physios, for example, physios are very used to working in a hospital environment, but they've never seen people who have died before. They've never seen a dead body. We didn't really clock that until after, because no one stopped. We just kept going and going and going, and people didn't want to let us down. That's had a huge impact on those staff. And we have actually got lots of our normal counselling available, but we have employed a psychologist from the money that we got from Sir Tom, which we thought was really good use of that, and we felt he would really welcome that. The psychologist can give one-to-one support, but also group support. And I'm actually very happy to share with you that they're doing some group support for us as execs too. No one exempt from the need to support your mental health, which is just a real good follow-on from what you said earlier, Stephen. We opened the staff nursery because lots of people were extremely stressed about childcare because you couldn't get any. So the staff nursery was open 7 days a week, 12 hours a day, and there was some real joy there. Again, if you look at the other videos on the website which are there, you'll see them talking about VE Day when they had a big party, and they looked up and the staff were looking out of the windows into the garden while they were having the party. Those moments of pure joy. Obviously the food and the car parking is always a nightmare, isn't it? But because people weren't here, we were able to give our staff free car parking, and actually we haven't begun charging again for that. We will have to, but we're just going through a process of making sure that the right people have got the car parking permits. But that has, I mean, it's been quite an incredible journey. We're doing lots of yoga, fitness lessons. There's been a challenge, eating challenge. The physios have done some of that in the OT. So there's been lots going on for the staff. And also there's a huge plethora of companies now which give NHS staff money off, and it all helps with mental health. The one of the things for me actually was keep reminding the senior team that behind the hard work and the emotional need from that, people's lives were falling apart. So what Sarah, myself and Bernice talked about a lot was, who's doing a lot of extra shifts and why are they doing them? So are they doing them because they want help and they've got nothing else on? Are they doing them because they feel they can? Or are they doing them because their husband's lost their job and they're about to lose their home? I think that's been really key. My son lost his job, was worried about making his rent payments, you know, all of the stuff. So our lives were really tricky, and behind that, our lives were falling apart, many of us. So I think that that's been really important. I have to say, I think most people are back on track. I've done quite a few walk rounds, and my team, like Sarah, have been meeting with all the sisters, and everyone seems back to their normal happy self. But there will be people underneath that. So we've been asking ourselves, you know, let's check in with people. Let's just watch. Are they behaving normally? Where are the subtle small signs? Have they got enough food? You know, those sorts of things are really important. The environment's changed. We've got lots of new areas, lots of new services, lots of different ways of doing things. Cleaning has been key. We've been really well supported by our cleaning teams, and everything is wiped within an inch of its life all the time. So do feel assured. We've also increased our air changes in most areas so that the air is changing more frequently and particles don't have a chance to settle so well. And what can you do to help us? Keep everyone well. Keep yourselves well. I think that we did get a bit complacent in terms of thinking it was over. It's not over. It's not going to be over for a while. Keep washing your hands, keep gelling. Please wear your masks. Please encourage other people to do so. And please make sure that if you've got any symptoms, you come and see us, because we'd love to see you. So thank you.
Thank you, Sally and Sarah, for that. Range of information there. Obviously, there's a lot for people to process. Whilst I actually wait for any further questions, because we're going to probably come out of the presentation mode now. Please, thank you. There was a follow-up question to the dementia question posed earlier from Paula, and it was from Hen. And she's asked, is there a place for people with dementia who may be on other wards, so non-dementia wards?
There is, but actually we don't really need to worry too much about that, because we've now got outreach if someone is in surgery for a short period of time or in the other areas. But ED, we've got the dementia friendly environment. Our outpatients is dementia friendly. And then our wards, now that we've got 3 full dementia friendly wards, we would move a patient there and consider the consultant in reaching to those wards rather than have someone not in the right place. We haven't really had a problem with that, I have to say, but it would be a worry if we started getting very busy again.
Yes, I appreciate that. Councillor Schapp was actually just agreeing with you, saying it is concerning what's happening in the workplace on people's mental health and working longer hours, burnout especially. I think we're all kind of very aware and conscious of that in our general lives, but also the workplace where people's commitments who are on the front line, who we're dependent upon for our health and well-being and lives in many occasions in relation to COVID, very much appreciated locally. And as I've said before, you know, from a Health Watch perspective, I know from everybody on the screen, huge thanks to yourselves and all your colleagues at the hospital for all the kind of hard work and efforts, the additional hard work and effort that you put in to try and sort of keep things safe for as many people as possible in the area. So thank you again. Before we move on to the next presentation, are there any, with the mental health theme, counselling perhaps, doorknob comments? Jillian's got her hand up. Excellent, there we are.
Just to say that you really should get a pay rise. That's all I would say. Clapping for carers is one thing, but where is the money?
Thank you.
Thank you.
As Health Watch is not political, I won't comment. Basically, I have similar sentiments. There we are. Charlotte, you've got your hand up. Sorry, I didn't see you.
Having lived with a condition called mental
Charlotte, can you
health
speak up a little? Sorry, we can't hear you.
Is this better?
That's better, thank you. Yeah.
Right. Having lived all my life with what is now known to be a mental health problem, is it possible that people with mental health problems who have learned how to cope with them be of any help to those who are new to being mentally health impaired, to help them understand how they can cope on the positive side of their lives and not be turned down?
That makes a lot of sense, Charlotte. And I saw, I think Councillor Shepard had her hand up. Were you just, we lost you, sorry, Councillor. Or you're just saying goodbye? Maybe that's what it was. Okay, so thank you, Councillor, for joining us.
She's
No,
just
I think that makes
apologies that she's had to go, so that was a goodbye wave.
Okay, fine. Thanks for clarifying. Thanks, Charlotte. Very important, actually, and you know, it's the involvement of those with lived experiences of all sorts of conditions, health, well-being conditions, mental health, obviously being the kind of theme du jour, are centrally, crucially important to challenging the system, monitoring the system, developing the system, and I think many colleagues on this call today and others that they work with are very aware of the benefit that brings to ensuring that quality is maintained and new service specifications meet the needs of local populations. So I think absolutely well said. Okay, I'm good. Before anyone else puts their hand up, Sally and Sarah, thank you so much for that.
Thank you.
Really, really well received and very informative, and thank you for your patience with our questions.
That's all right. Thank you.
If you have to
Thank
go,
you
that's
for
perfectly
inviting
fine.
us.
You're welcome to stay as well if you wish, but understand if you do need to dash off, that's perfectly allowable. And I'm going to switch without further ado to our other guests from South West London CCG. Thanks both if you are going. Bye-bye.